Mag-course to tayo to Rosa, and then from there, yung sabihin kasi kung ako, hindi ko nila ko kilala, diba? At least kung si Rosa, sabihin mo lang na ano.
Naka-ano to, no? Naka-mute. Kasi kapag
Kasi pag ako, hindi nila pala ang like si so, pwede ikaw to, ay, ang sabihin mo kay Rosa, to be added to the invite list para sabihin mo kasi so that in future when you will receive it.
pati
Diba, I don't know,
sasabihin naman namin sa'yo. Basta kami naka-ano.
oo, kasi important. Pero inad naman na ako. Okay, ito na sila. Okay, perfect.
Hi, everybody. This is Heather Korbulik. I'm just doing a sound check before we get started to make sure you can hear us. All right. I've had to unmute our microphones for everybody. So just as a common courtesy, if you would please mute your microphones. And thank you for being here today. We're about to get started. I just wanted to remind everybody that this is a presentation that we record for your convenience, and so that we can post this to our Enrollment Professional website, and you can listen to this presentation again at your convenience or share with people who you think may find it interesting. So thank you again for being here today. We're looking forward to updating you on the work we've done over the last month and bringing you up to speed on where we are with our transition, giving you a little bit of information. I'll move to the agenda. We'll give you a little bit more information about not only where we are with our transition project, but also some specifics about training certification for our brokers and our exchange enrollment facilitators. Get you some pictures and information on how the broker portal works on the Get Insured system. Talk to you about high-level plans for communications and messaging for consumers And then we have some questions and answers that we received in advance of this training that we're going to be answering. But I wanted to pause here and first of all remind everybody, for those of you who have just joined, that this is a recorded presentation and would appreciate if you would mute your mics to eliminate any background noise. And that you're welcome to ask any questions that you have either by phone once we get to that Q&A portion, or through the chat feature on this Zoom presentation. And I will leave you with contact information for the exchange participants. So let's get started. As I said earlier, my name is Heather Korbulik, and I'm the Executive Director of the Silver State Health Insurance Exchange. Just reminding everybody to please take a look at your mute button and make sure you are on mute. Ryan High is here in my office with us, and he is the Chief Operations Officer. We have Rosa Alejandre, who's our Navigator Program Manager, Rebecca Lamazzo, who's our Broker Liaison, Janelle Davis, who is our Communications Manager, Russell Cook is our Information Systems Manager, Eric Watt is our Project Manager, and Athena Cox is our technology analyst who has helped to set up this meeting. So let me tell you about where we are in terms of the connections and making all of this wonderful state-based exchange work happen. First and foremost, April 15th was an important date for the exchange. That's when we received our application test files from CMS. So this is a test of the consumer migration. All of the data that is currently in healthcare.gov for our consumers is going to be migrated into the Get Insured platform. So we have received the test files from CMS and are currently in the process of making sure that the Get Insured system can receive those files and can translate and work with, populate the Get Insured system. I'm just reminding everybody one more time that you please put your phone on mute. Thank you. Now, let's see. We are in the midst of a really important component to this migration, and that is our information security plan. We are required to jump through a variety of different hoops to ensure the privacy and security of consumer data and the integrity of the federal tax information and PII that we receive through the exchange. In doing so, we have to put together what I believe is around a 600-page document demonstrating all of the measures that our exchange, our vendors, and the Division of Welfare and Supportive Services have taken to make sure that that security is intact for our consumers. So we have submitted this to a third party, our plan, to a third party vendor who is now going to pressure test that plan and basically audit our intent. And then we plan to submit this plan to the Centers for Medicare and Medicaid Services for final approval. And this will grant us our authority to connect. And so that is all in the works and making a timely effort to get that done in time for, is it August? Is our deadline? Yes, correct, August. Okay. We're also currently testing our connection to the Federal Data Services Hub. We, as many of you probably are aware, when we receive an application from a consumer, we have to go out and ping the Federal Data Services Hub, which is inclusive of the IRS, to ensure the validity of the income that's been provided to us. We have to go to Homeland Security to ensure their residency. And so those are important services, and we're working with the Division of Welfare and Supportive Services to use their hub connection to do our initial testing while we develop our plan, or while we wait to get our authority to connect so that we can continue to test that. We're also in the process of electronic data interface testing, and the first EDI tester a qualified health plan carrier began testing on April 1st, and so far so good. They've had successful tests so far, and they continue into this next month. The rest of our carriers will begin electronic data interface testing on Monday of next week. And so we're looking forward to having a smooth process for our carriers and ensuring them that we're able to send and receive the important business critical function, or business critical files that are going to make sure that everybody gets paid and that consumers are covered on health insurance. So that's a critical part of this transition, and we're in the middle of that. We also have started doing some user acceptance testing. So the Get Insured platform has, there's a sandbox environment for the Exchange project management team to go in there and push around and try to break the system. So we're in the middle of that user acceptance testing, and it will go on for several more months. And so far that is going very well too. In terms of training and certification for our brokers, we're really excited to be really kind of narrowing in and getting these details all worked out, and looking forward to giving you all more information about what this looks like. So what we're going to do is assume that any broker or EES who is currently partnered with Nevada HealthLink or healthcare.gov, we're going to assume that you plan to participate for plan year 2020. And that's going to be important in a minute. We're also going to be soliciting all sorts of new brokers. We're really looking to beef up our enrollment pool so that consumers can get connected to brokers and enrollment professionals to get connected on for plan year 2020. That's a critical part of our success in this next year, is making sure that we're connecting consumers to enrollment professionals to get the necessary. So anybody who is not currently partnered with Nevada HealthLink or healthcare.gov is going to be receiving an email from Nevada HealthLink in May. And we're going to ask those folks to confirm their interest or their intent to sell on the exchange for plan year 2020. And we're going to be getting a list together from that communication. From there, anybody who is existing or who is newly interested is going to receive an email from the exchange, and that's going to be sometime in the month of, probably late June or early July. You're going to receive an email from us that's going to give you access to the training. And that is going to be on a platform called MindFlash. The email, we'll make sure you know when it's coming and that you feel comfortable about this, but the email will be from Nevada HealthLink at MindFlash. And this is your opportunity to get into the certification training and complete that. And then also, while you're in that training, you're going to see a broker code of conduct and a required agreement, an acceptable use agreement. We're going to require everybody on the phone to please mute. We are hearing some background noise. Okay, so we're going to be requiring all of that, seeing that you finished your certification and seeing that you've signed those two agreements before we will give you access to the broker portal in the Get Insured platform. I'm not sure if we talk about it on the next page or not, but I think there is something in this presentation where we talk about this, but I did want to reassure people that we are working on developing, first and foremost, an abbreviated version of the CMS training. We do not anticipate that this training will take nearly as long as it does on healthcare.gov to complete. And we're also making sure to incorporate information about our transition and how to use the Get Insured portal and how to coach consumers on how to use that portal too. So that's all forthcoming. We wanted to also give you some insight into our plans for consumer messaging. And again, I'm just going to ask one more time that everybody take a look at their mute button and make sure you're muted, because we are getting some feedback noise. Thank you. So we have been working for over a year now on developing our plans to communicate to consumers. And we really wanted to talk today about how important your involvement as an enrollment professional is going to be in assisting consumers and making sure that they get logged in and connected to their health plans for 2020. So there will be a requirement for consumers to claim or verify their account on the Get Insured system. And I should put a little asterisk here and remind everybody that if a consumer is eligible for automatic re-enrollment on healthcare.gov, then they will also be automatically or eligible for automatic re-enrollment on Nevada Health Link. But we still really want to make sure that Nevadans are logging into Nevada Health Link and taking a look not only at the system, but also verifying the information in their account. So it's going to be critical for our enrollment professionals to help consumers do that. We will have that system available to consumers will be able to log in and take a look at their accounts on September 4th. And so there's going to be a lot of consumer messaging building up to September 4th and throughout the month of September to get people over there and take a look. Brokers and exchange enrollment facilitators will also be receiving communications about how to get connected to Nevada Health Link and, of course, information, like I explained earlier, about our training and certification. And we're going to start sending direct messaging to consumers once we have the most complete picture of everybody who's on a plan year 2019 plan. We'll take that data and we'll send direct mail to every one of those consumers. First, the direct mail will be, keep an eye on your, or the direct mail will, the communications messaging plan will be very much the last week in August, the last few weeks of August, saying, watch your email, here comes some messaging, you're going to want to pay attention to what we send to you in your email inbox. We'll also be coupling that with a direct mail campaign right around the time of September 4th that will tell people to go take a look at their email and to connect to Nevada Health Link. And during that week of September 3rd through the 6th, we'll be really pushing messaging around come in and take a look at our system and claim and verify your account. During the month of October, this is new, the exchange, anybody on Nevada Health Link will have an opportunity to take a look at the plans that are going to be available for plan year 2020. And that's for the whole month of October. You'll have the opportunity to do that. We think that's going to offer consumers an opportunity to do some early window shopping, but it also offers enrollment professionals a whole month before open enrollment to take a look at the plans that are going to be available and start to think through where they're going to connect their consumers. We think this is going to offer an opportunity to have less pressure during the months of open enrollment and give you all more time to better help consumers. So we wanted to also show everybody some pictures of what the broker portal on the Get Insured system looks like. Oh. Okay. So this, and apologies for the small pictures here, and I just wanted to kind of give you guys an understanding of what you'll see when you log in. The other pictures I'm going to show you are a little bit more clear. But what we're trying to show you here is that this portal is a complete solution for a consumer to make delegations. So you'll be able to log in and take a look at your list of exchange consumers and then create and manage your own public profile. And that profile is going to be used when a consumer wants to designate you as their broker of preference. In this picture, what we're showing you is a list of pending consumers. So this shows you a list of individuals who have requested to delegate you as their broker or agent or their enrollment professional, and it gives you an option to accept or reject that delegation. You can also filter this list by consumer's name and last name or the date range in which the designation request was sent. I'm going to ask everybody one more time to put your phones on mute. There's a lot of background noise, and we'd really appreciate it if you would make sure you're muted. Thank you. Here you're seeing a picture of your active list of exchange consumers. So this is where you can see a complete list of their name, address, and their application status, any kind of next steps or issues that have popped up for that consumer are going to be highlighted here. And of course, you're able to, you can see here, you can export that as an Excel spreadsheet. Can you see my mouse moving? Okay. And then you also will be able to sort this however you choose. This is the last picture we have, and I'm really, again, going to solicit your feedback. If there are areas that you'd like to see more of for our next training, please don't be shy. You can make a comment in the comment feature or the chat feature right now, or you're welcome to send us an email at the end of this presentation and let us know what you'd like to know more about. But this is a picture of the way that you can filter. So right up here you're seeing different opportunities to filter and look at your list. You could do it based on application or the issuer. You can do it on the application status, on the person individually, or the variety of different things that are listed here. So we just wanted to make sure that you felt comfortable with the fact that you will be able to manage this list however works best for you and the way that you work. Getting into some questions that we've received over the last few weeks since we've met last, and again, I'm going to mention that please feel free to share any questions in the chat feature if you have more. One broker asked us if brokers or EES are going to need to take all training modules or if there's going to be an abbreviated recertification. And I'm happy to tell you that, like I mentioned earlier today, enrollment professionals who are partnered with Nevada Health Link right now for plan year 2019, or those who were certified to enroll on healthcare.gov, are going to be offered an abbreviated recertification training that will include any new information as it relates to state or federal regs, along with some details on how to use the Get Insured platform. Any new enrollment professional who is not currently partnered with us or who is not on healthcare.gov is going to be required to take a more comprehensive training. And like I said earlier, that is a more comprehensive training, but I want to assure everybody on this call that that is an abbreviated version of what CMS requires right now. We recognize that that is a very tedious training, and we intend to do the best that we can to streamline that and make it very useful for everybody's time. So we're looking forward to offering that, and you'll be receiving more information on that here in the next several months. Another question that we got was, how will consumers be contacted and or claim their accounts if their initial application was established using a one-time or a non-primary email address? So we are going to be taking a multi-pronged approach to our communication with consumers, as I kind of outlined earlier. We're going to be sending hard mail, so snail mail, I'm not sure how we even talk about that anymore, to consumers directly to their home addresses, asking them to look at their email and to access their login. If they don't remember their email address, they will have the opportunity to contact our customer services center and get more information or get that data sent to them at their more current email or whatever it is that they need to get access. So they're also going to be receiving, of course, electronic notices, and we will be sending lots of emails and we have the ability to know who has and who has not opened those email addresses and can send repetitive or persistent emails to consumers who have not opened those emails. Along with the direct mail campaign and our messaging on our consumer-facing platforms such as Facebook and social media, along with some more refined ability, or we're working with our partner Penna Powers, who is our marketing vendor, to kind of expand on consumer messaging during this time frame, and we'll be giving you more information on that pretty soon. But I just wanted to make sure here to let you know that there are multiple channels that a consumer can get information about how to claim their account. And something that is just as important and that I emphasized earlier, but I want to say again, is you are a critical component to making sure that consumers are claiming their accounts. So if you go in, once we grant you access and you can see your list of exchange consumers and you're feeling like, oh, I'm missing somebody, then we need to know about that, and we need you to reach out to that consumer and make sure that they are designating you as, or that they're getting logged in accordingly, and that they're designating you as their enrollment professional. So another question that we got that I thought was really wonderful, and I'm glad we got it, is about whether or not brokers will be copied on any communication to consumers. If a broker has designated you as their enrollment professional, you will be copied, or you will receive a copy of communications that are sent to your clients. You won't be receiving an email every time somebody gets a notice or a trigger notification saying, for instance, that they had a data matching error and need to submit documentation. But what you will receive is a daily summary, and that will give you an idea of individuals who are in your list and who have received notifications so that you can help them follow up on that. You'll also be able to, of course, at any time log into your broker portal and take a look at any notifications, new or existing, and filter according to that. And then the next slide is in response to another question that we received, which is really kind of trying to get to the bottom of how the process for Medicaid or CHIP transfers for consumers who start their application through the Get Insured portal, how it looks. And please note, this is actually the highest level of a tedious, complicated process that I can show to you, because there's a lot more detail in each of these pieces. But we wanted to make sure that you understood that we've set up a business process flow with the Division of Welfare and Supportive Services that allows for the transfer back and forth of Medicaid and CHIP recipients. So if you look here, if somebody's coming over to Nevada HealthLink, and they initiate an application through our portal, whether it's the Get Insured or Nevada HealthLink portal, then we basically do an application, and then we verify that information in the application. So that's when we go out here to the federal hub, and then back again, if this person, or we're verifying their identity, and then we're coming over here and this person is asking for financial assistance. If the answer is yes, then we verify those eligibility factors through the federal hub. And if it's at this point that we're assessing them for Medicaid and CHIP. And if that is the case, that they are Medicaid CHIP eligible, the transfer is initiated all the way down here to Division of Welfare and Supportive Services, who will then take that application and process it accordingly. If that person is deemed Medicaid or CHIP ineligible, the Division of Welfare and Supportive Services will transfer that back to the exchange, and that individual will be able to claim the application and begin their exchange enrollment. I'm going to open it up for any new questions and see if we have any in the chat box. Do we have any, Athena? No. Okay. I'm not seeing any. Would also just like to offer an opportunity for anybody on the phone to ask a question if you have one. Okay.
I have a question.
Okay.
This is Jeremy Sugarman. So initially, when all the apps come over from healthcare.gov, are we going to be assigned as broker regardless of whether they appoint us as a broker?
Great question. So the data that is being migrated from the Centers for Medicare and Medicaid Services or from healthcare.gov is going to also migrate the NPN numbers associated with that application. So it is our intent to, once we grant you the ability to use the Get Insured portal, then you should have a list of all of your consumers. If that list is missing people, it's because that application in healthcare.gov did not have your NPN number affiliated with it, and we're going to ask you to reach out to those consumers and make sure that they go into the Get Insured portal and designate you as their broker of choice.
Will they be able to go in once that system is up and undesignate us for any reason?
They absolutely will be able to go in and undesignate if that's what they choose to do. Okay, and we have a question on chat. What is it?
Will consumers who are denied Medicaid, will the exchange grant them a special enrollment period? If a consumer is denied Medicaid, will the exchange grant them a special enrollment period?
It will work the same way as it works right now, and I think I would like to just kind of take that question and make sure that we answer it more completely at our next broker training. And so I'm going to flag that as something to follow up on next time. But I wanted to let you know that at a very high level, the same process that happens now will happen on our new system. Do we have any more chat questions?
I have a question.
Okay, yes.
This is Matt from Health Benefits Associates. If there is, just like we've had in the past with people on healthcare.gov being mapped to new plans during open enrollment, are we going to have the same mapping process during the transition?
Yeah, so the formal way of referring to that from CMS is called a crosswalk. And yes, for any carrier that is not going to be offering the plan or one specific plan, those individuals who are eligible for automatic re-enrollment will be crosswalked to the most similar plan available. But again, we're always encouraging consumers to shop during open enrollment and make sure that they're getting the best plan for themselves. And so they'll have an opportunity to shop during open enrollment and make changes should they choose to.
Perfect. Thanks, Heather.
Okay. Anyone else have a question to ask on the phone or in the chat feature? Okay. Okay, well, again, we really appreciate this opportunity, and I encourage you to submit your questions. Oh, we do have a question? Okay, yeah. Go ahead. Will you read it to me?
At this point, will there still only be 2 companies being offered?
Well, first, I should always say that we have actually 6 standalone dental plans, and so we don't think of it as just 2. There are several exchange carriers that we are anticipating a full return of all 8 of our carriers, and we do feel encouraged about the potential for an additional qualified health plan carrier. Any other questions?
Matt Lau is asking if we can send a copy of the slides. Some have small print and were hard to read.
Yes.
And yes, this presentation will be posted.
Yes, we should have mentioned that, and I don't have the website here, but you should know that we have, and we'll send an email out to everybody on the call. We have set up an enrollment professional website, and so this information, this presentation will be posted there along with the recording of this presentation. Anything else? Okay. Okay. Well, again, this is our contact information. Please don't hesitate to reach out and send us questions so that we can make sure we're getting answers to you. It doesn't have to wait till the next monthly meeting, but we're looking forward to speaking with you all again in May. So have a good afternoon, and thank you very much.